Hello and thank you for joining in on today's training. Heart & Solutions is a proud provider of CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below to find and take your quiz.
I appreciate everyone being here today. My name is Dr. Colleen Grote. I am the Vice President of Therapy at Heart & Solutions, and we are kind of the oversight of You Need a Training. So we are here today for a training on ethical considerations in play therapy supervision. And this training is designed for play therapists interested in starting the process to become a supervisor or current supervisors wanting a refresher. So it's going to help all of us identify best practices for play therapy supervision. Today, we are honored to have Ebony Hutchinson here for this training. Ebony is an LCSW RPT and has worked in behavioral health since 2004. She's an adjunct professor at the Brown School at Washington University in St. Louis. She specializes in trauma with an emphasis on foster care youth. Ebony is also the founder of the Community Reach, a nonprofit that was established to increase access to specialized mental health services to marginalized communities. Ebony, thank you so much for being here today to share your knowledge with us. I don't want to take up any more of this valuable time, so I'm going to hand things over to you so we can get started.
All right. Thank you so much, Colleen. Again, for those that are with us live, I'm pretty informal, pretty flexible. So if you have a question or a comment, feel free to come off of mute. And yes, so let's get into it. So the ethical considerations for play therapy supervision. So here are the learning objectives, but what is important for us to walk away with today is recognizing that although play therapy supervision doesn't carry the same legal obligations that clinical supervision provides, meaning that someone is not practicing under our license and that we are not responsible for the clinical work that they're doing. But still, as a play therapy supervisor, it's important to remember that we do have liability that we need to be mindful of. We are the gatekeepers. So similar to clinical supervision, it's our responsibility based off of our scope of practice to make sure that when we are working with a clinician and signing off on their hours, that we can say, based off of our expertise, our level of competency, that this is someone that can go forth in the field and practice this intervention without oversight. Some of the things that we are going to talk about today are vicarious liability, what informed consent should look like, and dual relationships. Dual relationships is important to process through because it's easy for people to kill two birds with one stone. We know that supervision it can be an expensive process, and then going through the process of getting certified in play therapy is also expensive. So people will, if they are in the process of being provisionally licensed to get their independent license, and they know that they want to do play therapy and they're working on that, it makes sense maybe to find someone who's able to do both. And so it would be important, if you are in that dual relationship role, that you are clear with what hours, for example, might count for the play therapy versus the clinical supervision, how we're structuring the supervision sessions under the play therapy lens, what we're looking at versus the overall clinical umbrella. And so just a little bit about me. Colleen did share my bio, but one of the main reasons why I do what I do is that I really just truly love play therapy. And I think that it is, I think probably to me, the most client-centered, collaborative, and almost like could be the reference for just best clinical practice in general for how it's set up. So I feel like it just kind of sets us up for success. And another reason for wanting to make play therapy more accessible, I got my RPT after I had already been over a decade working in the field with kids in foster care. And although I feel like I was a skilled clinician and did good work, it could have been better if I would have had this lens. And so understanding our role. So there are three things that we want to make sure going into supervision that we're clear on. We want to make sure that we understand what ethical and effective practice looks like, enhancing professional development, and then promoting reflective practice. And so when we think about ethical and effective practice, we want to make sure that we understand what the role of a play therapy supervisor is and what the role of play therapy supervision, and that we clearly communicate that to our supervisees, whether this person is independently licensed or going through clinical supervision. We want that role distinction. You know, my role is not to make sure that you understand the principles of motivational interviewing. You know, my role is not to make sure that you understand the tenets of your code of conduct for social work or marriage and family therapy or counseling. My role is to make sure that you understand the guidelines for play therapy and that you are executing them effectively. Now, if I am noticing, you know, that there may be gaps or things that require additional support, I would encourage you, if you are under supervision, hey, I think that this might be something that you will want to take to clinical supervision to further explore ABC. If it's someone who is independently licensed, you may encourage them to perhaps like look at some trainings regarding ABC, and or, you know, maybe seek consultation with someone who is more skilled in that area. With professional development, play therapy, it's not just something that we use for kids, but, you know, the foundation is primarily, you know, like working with kiddos. And so the thing with kiddos is that they are developing and growing every day. You know, this person that I saw at the top of the year and at the end of the year sometimes could be completely different. We don't necessarily see that same level of growth in adults, right? Because the brain is already fully formed, that personality is set. So it's important for play therapists to recognize that you have to be a continuous learner. Like you have to be a lifetime learner. You have to make sure that you are investing in your skill set and your knowledge base because things change. Like I have been practicing independently since 2008 to 2025, almost in 2026, there's been a lot that has changed with kids. What kids have access to has changed tremendously. I am an old millennial. I did not know what something like genocide was. I grew up during Desert Storm, but I didn't have a clear understanding of anything that was going on any more than what I did with the Civil War, you know, reading a textbook. But the kids today, everything is at their fingertip. And you don't have to be able to spell. You can just literally say, let me not say that because my iPhone is here, but you can say, Alexa, you know, show me sex. And Alexa is not just going to pull up a definition. Alexa will pull up videos. Alexa will pull up pictures. So it's important for us to stay on top more than almost probably any other specialty in behavioral health on what is happening, what are best practices, what is research saying about child development. So really being intentional when we're going and getting our continuing educations. Yes, like the net CEUs, the PESIs, like those can be great because, I can get those very quickly. But did you really take anything away meaningfully that you are able to actually apply and be more effective at what you're doing? And so as a play therapy supervisor, you want to make sure that you are also reiterating those same things with your supervisees. And then reflective practice. So I tell everybody that I'm a professional oversharer. I think that people learn best like from real examples. But we have to be mindful that not everyone feels comfortable enough to be that vulnerable and like share something about themselves to process through. So I'll share and I'll provide, learning opportunities for my supervisees. I'll share that, what? I started my private practice and I didn't even have liability insurance yet. Somebody else told me, that I needed that. Or, I had a teenage client and it was our first session. And I asked this kiddo if she was from North Korea or South Korea. And she looked at me like I was from Mars, which, yeah, like, girl, I could only be from one, so just things where it's like there's growing and learning opportunities forever because we are working with people and people are not facts. People are not data. People change. There's diversity and variability and even how somebody manifests or presents with the same presenting issues. So it's important to be able to hear sometimes from someone who is more seasoned than you are. These are what some of my experiences have been. And here is what I learned from it. Because even those pitfalls are learning opportunities. And if we have done really good work with building rapport and establishing a level of trust and confidence within the client, there's always usually opportunity to repair, to bring it back, to acknowledge it, and to continue moving forward. So a supervisor's role is not only to provide clinical guidance, but also the support of the use of play therapy-based interventions, ethical decision-making when it comes to play therapy and navigating challenging situations with young clients. So when we work with kids, there are three clients. There's that child, there's whatever that caregiver, whether it's, like a parent, a guardian, whoever that person is, and then that family unit, that household unit. So there are three clients there. And most of the time when we see kids for therapy, we get that referral. It's because some adult in their lives wants them to stop doing something. It's not necessarily always that I want to understand and know why they're doing it. I want to, for myself, to get more educated and understand this diagnosis more. It's usually like, Bobby is doing this. Bobby needs to stop doing this. But when we're in the playroom and we're working with kids, like that's not necessarily the reality. What you're seeing is the behavior, but what you're not necessarily understanding is that this might be how Bobby regulates. And so until we find different ways for Bobby to figure out how to regulate, we might continue to see this, this behavior. And that could be a challenging thing to be able to explain to an adult, that I understand that you have this goal and it is important and it is meaningful. And I do want to get there. But before we can get there, there are other things that may need to happen along the way. When we talk to the adults and their lives, and versus the kiddos, sometimes there's completely different, goals and objectives. And that can sometimes be in conflict, and there could be tension there. So these are skills that are going to be really important to be able to help assist a developing play therapist with navigating. Because when you are working with kids, you're going to have more conflict and tension that you're navigating probably than any other population that you're working with, because there are so many hands in the pot, so many opinions, and so many feelings that you have to balance and navigate and figure out how to be neutral and so and validate each person. So play therapy supervision versus clinical supervision. Both are going to aim to support a therapist's development. Both are going to be looking at clinical situations and clinical skill sets. Both are going to be identifying, like opportunities for growth, and also what's going well, like what are skill sets that we could continue to build upon, what are transferable skills. But the most important difference is that the play therapy supervisor is focusing on this intervention. Think about the difference. There are 35 hours that we're providing in the span of a minimum of 2 years. With a clinical license, that is weekly supervision that you are doing for a minimum of 2 years. If you do have someone who is also in clinical supervision, it would be important for you to know who that clinical supervisor is. It would be important for you to have a way to be able to contact them and share, information. And this is something that you would include in your informed consent forms, so the supervisor could be aware what your practice is. Because if you are noticing something, again, we're the gatekeeper of determining whether or not this person is ready to move on and utilize this intervention and these techniques independently. If we're noticing something in real time, like we want to provide like a cheat code. We want to put out here, this is how you are successful. There aren't enough of us out here. So we do want this field to grow, but we want it to grow with individuals that are effective. We don't want numbers just to have numbers. So if you're recognizing, Ebony seems to, like need some additional support around identifying risk, like safety risk and, like the duty to warn. And these are some areas that I think would be beneficial for her to continue to work through in supervision, as well as maybe taking some additional trainings. And that would be the scope of what our responsibility would be there. It wouldn't be our responsibility to make sure that all of the guidelines when you sign off on that licensure supervision are checked off. We don't have to say whether or not they understand family systems and how to apply policy and research, all of those things that you check off. But if we do notice a gap, we do want to share that, because children are a vulnerable population, and they may not be able to communicate to you as effectively as an adult would be if something is not working, if there's a missed opportunity, if there was an ouch moment. So it's important to make sure that we're identifying those things. And it's also important to make sure that for ourselves, we're putting that boundary there and we're not overstepping, because sometimes it's not the supervisee that's bringing something that really should go to their clinical supervisor. Sometimes it's us, having a challenge differentiating between what hat we're wearing, especially if you started off providing clinical supervision and now you're adding play therapy supervision to your expertise. So it could be that muscle memory sometimes that's a challenge to get out of. But think about what it was like if you did not start your career off doing play therapy. And when you first started using play therapy and adjusting to, oh, I'm not talking as much. Like I'm not being as directive, oh, I'm not setting up a session in this way. Kind of thinking about and using that as a transferable skill set. How did you make that adjustment in the practice, especially if you see adults as well, and you don't just do play therapy? How do you transition from one client, one population to the next? So keeping that in mind, if you are someone that provides clinical supervision and play therapy supervision. It's also important to remember that we want to move as much possible to that clinical supervisor, because that's the person who understands, who was supposed to understand what the board, the licensing board expects, and then also what are the expectations for that discipline, because a play therapy supervisor can supervise any discipline. So I'm an LCSW, but I could be supervising a counselor. I could be supervising a marriage and family therapist, a psychologist, but it's not realistic for me to understand the scope of practice for all of those disciplines. And it's not necessarily a reasonable expectation to understand the expectations for each discipline from one state to the next. And so you want to make sure that you're not taking on additional liability with trying to provide and help someone in real time troubleshoot something when you may not have the most accurate information or understanding, because things change from one state to the next, even within the same discipline. So relationships are important. And anything that we do, like our supervisees are not clients, we're not doing therapy with them, but they are coming to us, and it is a vulnerable process. You know, we are providing them with critique and feedback on their work. This is people work, it's hard work, and people feel very strongly and passionate about being in this space. And so sometimes it can be a challenge for someone to be able to take in that feedback, that there's an opportunity for growth or correction, because sometimes it could feel like it is a personal attack, because this is personal work. It's a challenge to remove sometimes the work that we do from our personhood, because our values, our belief systems, our past experience in this field is embedded in why we came here and the work that we do. So our work is very personal. So starting off, you know, with being able to create that safe space with your supervisee where they're able to receive, you know, like that feedback. It is, you don't have to be a professional oversharer, but, you know, like also, you know, like being able to show up authentically in that space, being able to, you know, like share what your experience, your journey has been like. You know, if you felt like you had this experience that was really great with your supervisor and your supervision, if you felt like this didn't, you know, like go well, you know, being able to share that, you know, like there are things that may land for you and may not land for you. But what I want you to be able to do, just like what I'm doing is providing you with some feedback. I want you to be able to let me know what's resonating with you and what's helping you the most. If there's any disconnect, I want you to feel like you're able to come to me and communicate that. Because just like on the back end, it's unfair for you to hear that, you know what, I can't sign off on your application, but you never provided me with feedback in real time or indicated that there was any concern about you doing that. At the end of your supervision journey, I can't do anything about you not getting something that you felt like you needed or not meeting an expectation if we haven't created that space where we're both, like sharing what this experience feels like for us. As a supervisor, you want to make sure that the feedback that you're giving is not personal feedback. You want to make sure that you're going back to APT guidelines and standards, not Ebony guidelines and standards. And so, an example of this, could be corporal punishment, physical discipline. Depending on what state that you're in, in Missouri, it is legal. And in Missouri, it's actually still on our books that schools can paddle. They, like most of them don't, but, in more of the more urban areas, but in the rural areas, like there's some paddling that is still happening. And so I may feel extremely strongly about physical discipline. And it may be something under no circumstance do I feel like that is appropriate, but that's an Ebony feeling of value. What the state of Missouri says is X, Y, and Z. And so when it comes to that topic, I'm going to have to defer back with the client to what the state of Missouri says, not what Ebony thinks and Ebony feels. And this is going into creating a safe space is also about like checking bias. And also for us recognizing opportunities for growth. You may think, because someone went through a program where, there's this big researcher who's doing play therapy work, then you automatically should come with a certain level of understanding. But that's a bias, like you may not. And so recognizing that just because somebody has been working with kids for 20 years, it doesn't necessarily mean that, this is going to be easy peasy, lemon squeezy, like you understanding the core components of play therapy. So what does ethical behavior look like in the supervisory relationship? Trust, respect, confidentiality, and setting clear boundaries and identifying like if there are dual relationships. So the ethical behavior, it really starts with us. We're modeling it. So if I am not holding you accountable to, it says 35 hours. And if we meet for 38 minutes and I say, just go ahead and, track it for today. If we don't have anything else, to talk through, you don't have anything else to present, track it for today. That is us starting somebody off with bad practices. There's 35 hours is not a lot. And if there isn't enough, like content to fill up a session, that is where things like, bringing in. So how are you using like self-care to help decompress, to recharge? What presenting issues are you feeling are the most comfortable and kind of automatic for you to navigate? Are there any nuances that are coming up with the clients that you're seeing where you're realizing, oh, like this is something that I need to brush up on here? So something now is like neurodivergence. And not just looking at neurodivergence as far as like the spectrum or even ADHD. There's research out that is even talking about how trauma and how that can rewire the brain and how it functions and how that can kind of cause a type of neurodivergence, as well. So like, just, hey, like I don't know a lot about working with clients that have chronic medical conditions. And I'm seeing that more. So kind of creating just the end, like just questions, just some check-in questions that you can utilize. maybe having some role playing, like case scenarios that you kind of develop to, like kind of go over with your supervisee if we're running out of time in a session, because again, it's the 35 hours. Another thing, like with ethical practices, yes, like someone could, this is recorded and there's a quiz, somebody can go right to the quiz and the questions. Most of us, like we have had to take a quiz. We didn't really have to watch it to pass it, but is that ethical? Are you taking anything away? The reason why our state boards and the certification boards require us to have a certain amount of training hours and continuing education hours is because it's best practice. So what does confidentiality look like? And so this is also something that you have to consider depending on what the setting is that you're working with somebody. If you are an in-house employee as well, where they're at, if this is someone who is in private practice under someone else's agency or their own, if you're in the same state as the person that you're supervising or not, because sometimes maybe things that are shared may look different. So like, for example, if I was in Iowa and I have a agency that does similar work, it might not necessarily be super appropriate for the supervisee to disclose or process through, okay, so this is how our play therapy trainings are set up. Some things might be intellectual property, like they shouldn't share the trainings, with me, or maybe resources that they're getting from their employer with me to share with other people. That could be one thing with confidentiality. It's not always about client information, but in play therapy, supervision, we don't necessarily need as much demographic information as a licensure supervisor would need. But we want to make sure that there's a checklist. Again, so we know where our supervisee is practicing at. We know what that hierarchy or reporting system is. So if they're not in a solo practitioner somewhere, who do you report to? If you're under supervision, who is your supervisor? Because even if we hear information and we want to make sure like that this was followed up on, if we had to make a report ourselves to follow up on something, we need to make sure that an investigator knows exactly where do I go to get that additional information. So I don't need to know that Ebony's last name is Hutchinson, that she lives in the state of Missouri, that she goes to this school, that this is her homeroom teacher. I don't need that level of detail. I don't need to know who the guardians are. But if I'm able to say, Ebony sees Colleen practices here. This is this agency's contact information. This is, like the client, this is all the information that I have. Or being able to follow up with the supervisor. Hey, Jessica, I met with Colleen this week. Colleen shared this. I instructed Colleen to do X, Y, and Z. Did this happen? That would kind of be like what the information we would need and why we would need that information. Because again, even though we are not responsible for that clinical practice, you do have to remember that any certification also defaults back to your license. Like we still always have a license. We are still always practicing under a field, a discipline, and there are expectations there that we're supposed to follow. So we want to make sure that we have enough information so that we have limited the vicarious liability. There's a question. Go ahead.
It's just me. I mean, I was just saying, like, it's one of those things that seems so straightforward, right? Of like, yeah, of course, that's how this would go. But I think it often can get kind of lost in the shuffle. And so it just is so clear and makes so much sense when you lay it out that way.
Okay. Thank you. And one thing that the difference is that, so if I live in California, we all know that California prices are California prices. They're not coming down, this is the price. But I live in California and I can find a RPTS that lives in a state where the cost of living is significantly lower, like $75, $75 versus $175. So you will find people that are shopping and looking for someone sometimes, not just based off of the expertise, but also cost. And so keeping in mind that setting yourself up for success and having as much of that demographic information on your supervisee as possible is important.
Ebony, you may speak to this later, but it brings up a question for me then as far as setting prices for supervision. So I don't want to jump in if you have that, but
no, we could go ahead. Yep.
Thinking about it from that perspective, right? I think, especially maybe those of us in the Midwest, right, are kind of confident, like, oh, I don't want to overcharge, or I want to make sure I'm accessible, but thinking about it, like you're saying, of like, am I setting myself up then to be shopped for, like, and maybe not really be the best fit for somebody or things like that? Like, do you have any guidance on kind of how to value yourself effectively and trust your skills, but kind of put yourself correctly in that market?
Yes. So one thing that I always, because it's very easy for us to feel like, because this is people work and being accessible means that if you only got $25, then that's what I will take. But we also have seen how there are so many content creators and so many coaches and so many mental health advocates that are giving information out here that would best be served getting from someone who is actually qualified to provide this direction, right? And so one thing that I say is, like, first think about the things that you do. One thing that I always tell my supervisees and my students is we don't sacrifice our personhood for the work that we do. And so if it means, in order for you to have a certain pay structure that makes you accessible to the point that you are having to work 50, 60 hours a week to be able to maintain your cost of living, that's not balanced for you. And that's not you protecting your personhood doing this work. If you work for an agency already, if you're working with foster care youth, if you're working in a space where you are already doing the people's work and you are, already kind of, I'm not making what I could make if I did X, Y, and Z, this supervision is something additional. Like, this isn't something somebody has to do. It's something that somebody wants to do. Clinical supervision is something that somebody has to do. So you sitting and you thinking about, what am I carving out where if I'm doing this, this is my price. Every hour that I'm meeting with somebody doing this work is taking away from an hour somewhere else. Thinking about your time as a bank account. When you take something out, that's a transaction, right? Like, so if I've taken an hour of my time out, that's a transaction. How do I build my account back up? So do I have to now do 3 hours of work to build up what I lost in that 1 hour? That doesn't make sense. It doesn't have to be done, remembering that it says a minimum of 2 hours. I mean, not 2 hours, a minimum of 2 years before you can get certified. We've all gone through that. 150 hours. Like, if you have really honestly done that in 2 years, that minimum, not saying that you didn't take anything away from it, but that's pretty fast. And so if somebody is on a budget, like, being able to talk to them about, it says a minimum, maybe you consider doing a phase a year, but I think that you have to sit and kind of figure out what makes sense for you. And then if you do something like, like out of state, I would say that, I wouldn't necessarily like market a price, like how people put like their range of therapy, that it's a range. I will put that what that range is. I offer a different price for supervision for individuals that work in agencies or work in school settings than I do for individuals that work in private practice settings, especially if you work in a private practice that's self-pay, because that's about equity to me. So I'm looking at that person the same way that people kind of make the decisions on who qualifies for a reduced fee therapy session. You utilizing that. Maybe you just don't have a flat rate, and maybe something that you consider is, hey, when you are not in this state, for me, the way that I practice, that requires me to expand my knowledge base in a way where it's additional time. It's not just muscle memory, because for me, it is important to maybe understand some of the nuances for that state. So maybe it is that this is what the going rate is in this state, and that's what I use for that state. And maybe I've done the research, I've gone online. This is what the average price that RPTSs are charging in Montana. And so this is my rate. So maybe, like kind of bringing that in. Does that help, Colleen? I feel like I was rambling too.
No, it's incredibly helpful. And I think it's validating too, to hear, just that kind of reminder of like, what's your rate, right? And like, what is your time worth, and how much of a deposit would you have to make to get that time back? And I think just being able to normalize that type of thinking in our field, right, can go a long way. And so I really appreciate you sharing and that insight. So yeah, it helps a lot.
Okay, perfect. Thank you. And dual relationships, depending on like where we're at, and what identities we hold, and like what communities we belong to, it could be a challenge not to have a connection point to somebody outside of just what I'm doing here. And so if there is a possibility that a dual connection or relationship may show up, addressing that. So an example could be my son's play therapist is one of the clinical supervisors that we use for my agency for my staff. And so I don't work with her for play therapy supervision. But something like just kind of putting it out there, like I work in the field and that is kind of close. And so I made sure like that my staff knows about that dynamic. She's aware that my staff know about it. I've given her permission to utilize my kiddo as an example, for my staff, since, that could be a real life. So processing through like kind of like what some of that looks like. If you are in a smaller community, like, and you work in a school setting, you may not be able to say, you know what, I'm not going to see my doctor's kid. If there's only one district and it's a really small area, like there is going to be some overlap. So, like, what does that look like? Sometimes, you could be a therapist and your kiddo could be in the same school as some of the kids that you're working with. So just kind of getting up front on top of like what this awkwardness can look like, and collaboratively, like, how can we agree to go about navigating this? And then also having a plan B in place. And so, if we get to a place where this kind of gets too icky and it's too muddy to kind of figure out, how we kind of pull it together. Now it's this big ball of yarn and we can't figure out where it starts and ends. Then we kind of say, okay, so how do we transition, like you to someone else where you can continue the work that we're doing here, the same way that we would do, like kind of with a client where maybe, okay, I've gone as far as I can go with you, and I've identified that this is what you need now. And so let me work with you collaboratively to find some fits. And when you're like, yes, this is it, then we can kind of transition off. So informed consent. We want to make sure that we clarify the expectation. So what are the roles and the responsibilities of the supervisor and the supervisee? Reinforcing like what the goals are, and how we want to make sure that communication is handled. So this sets up accountability. It also makes it very clear, like, hey, like I am not working with you in regards to the EMDR, like, so when that comes up, I understand that like you're stuck here, but this is not what, like the play therapy supervision is for. Are you able to maybe identify like how play therapy is, like is being used with this, like intervention, or how you're thinking about you can utilize play therapy with EMDR, if not, like I'm going to have to, like encourage you to go back to someone who can help you with this question. And it being like, this isn't about, invalidating you. It's not about, ignoring a concern that you have, like, because I understand like this is something that you need assistance with, but remember, we only have 35 hours together, and it seems like a lot, but it's not a lot. And this is a very big, broad field, and so there's a lot that we want to make sure that we're working through and we're accomplishing. It's important in the expectations, that you are also clearly identifying how the sessions are structured. So my expectation is that a supervisee, regardless of why I'm supervising you, that even students, that you come prepared with something that, like you're going to focus on. And then, like I may have, a skill set that, like maybe will reinforce. I may have like an activity that might bring in to help go deeper on something. We may decide like that, okay, for the next few weeks, we're going to focus on non-directive, because you have, like kind of shared and looking at the video, like that this is something that we need a little bit more practice on. So how can we do that? If you're someone and you have access to kiddos, like let's challenge you like once or twice a week for the kids that are, accessible to you, like whether your own kids or nieces or nephews, that you spend some time practicing with them non-directive play to, like build up that muscle. We want to make sure that it clearly identifies like how we're going to provide feedback, how we're going to guide you with the personal growth, what, like we're going to be looking for, when it comes to signing off on the completion of those consultation hours and whether or not we're recommending it. When you do clinical supervision, well, I can't say that because I went back and each state kind of has something different. But in the state of Missouri, for social workers, every year we have to provide an annual report when somebody's under clinical supervision, and we're evaluating them. And then we're also saying if this person is on track to completing their hours, and if we think that we would be recommending them for a license. And so anything that you are sending off, it's the same way like if we had to do a hotline, right? Like if you're doing a hotline with a client that you work with, it's from something that's come out during a session. It's better that we kind of address that, like, hey, when we talked about confidentiality, when I talked about what are the limits of that confidentiality, this is what this looks like. These are what my next steps are. This is why, this is what I'm going to, like report or say it. And ideally, like sometimes we're not able to do that. But with supervisees, we should be able to say, hey, Colleen, I'm concerned about, how heavily you rely on your own childhood experiences to determine what is appropriate, inappropriate, normal, abnormal child development. Like I want to make sure that, like that it gives me a little pause on whether or not I feel like, you would be ready today to practice independently play therapy. I can't say yes, and I think that it would be important for you to continue to work on this area. And here are some suggestions on how you can do that. Because it still is important for us, like to be able to, like highlight for our supervisees, like where the growth and development needs to occur, but also like a pathway for how they can do that. And then also identifying like what is going well. And we want to make sure that, like we're focusing on making sure that there's accountability. So what clear informed consent is going to look like is, so what's the scope of my role? What are the limitations of it? How do I foster professional growth? And so for me, an example, I'm not an RPTS yet, but I will be. But with clinical supervision, one thing that I do is you do 2 individuals a month, and then you do group. And the group supervision is a skills lab. And so I facilitate that the way that I would facilitate a workshop. And there are activities that are application activities that you do in there. And there's handouts and there's resources, like that I provide. And for me, because I'm doing it through my agency, I'm able to utilize RCE. And so those skill labs also count as a continuing education opportunity for you. So that is something, like a creative way where we're kind of talking about how do we optimize on our earning potential. This field, we don't learn a lot about how to the business. So like that's a ideal like business, like wise for folks. And so in that, because I do feel like that I can't just tell you this is a gap, this is something that needs to be done. I feel like you're already paying me to do something. I also feel like I don't want to have this conversation 6, 7, 8 times. Why not consolidate you all into a group and we start focusing on like certain topics? So next week I have, I think it's small feelings, big screens is the topic. And it's about, telehealth and how we do that in play therapy. And it'll be some quick strategies, interventions, resources like free links for them to walk away with. So you identifying like what that looks like. Making sure that you identify like what are the ethics, the ethical standards that we're looking at. So you want to make sure that you have the APT guidelines in there. And then you want to make sure that you kind of have language that defaults to things that are kind of universal, like so hotlining, like duty to warn. If there are any other areas where it's like risk and liability, you want to make sure that that's clearly outlined in your informed consent paperwork as well. And again, there's not necessarily a survey, like that supervisees fill out about us at the end, But like, this is a certification that a credential that you have to renew. And so you also want to make sure that you are adhering to APT's guidelines and expectations, because a supervisee does have the ability to go back and say, hey, like, this is what my experience was. And, like, I feel like that something should be done about it. And we want to make sure that we're empowering our supervisees. We cannot be their brains. They have to be able to figure out and be able to navigate things. And it's not that you have to know everything, but you have to understand what you don't know. And then you have to have an idea of how you go get what you don't know. And if you can't do that, then you can't practice independently. So that's why it's important to make sure that we're putting some responsibility on the supervisee, that we're evaluating, having them like identify, okay, so what do you feel like you did well? Like when we're even observing those observation videos, before we give feedback, what do you feel like you did well? Can you identify for me where you saw non-directive, blah, blah, blah? Can you identify for me, where you, I like the kid, kind of got dysregulated, and, what was that like in that moment? Kind of asking them for their feedback, their input on how they did before we just jump in and provide that feedback and constructive criticism. We also want to make sure that with our supervisees that we are asking them routinely, like, what challenges are coming up for you? Like, where do you feel like that you've grown? Like, so it's been 6 months. Like, what do you feel like that, like you're learning that you're able to apply? Also asking them about the trainings that they're taking. Being able to be familiar enough with some of the CE providers, and, like, this is an agency that provides training specifically, like kind of specializes in neurodivergence or attachment work, and you're working with foster care youth, or, like, so I think that, like some of these trainings could be really beneficial for you. Kind of routinely getting some feedback from them about, okay, so like, what's going well? Where do you feel like that you need some additional support? And before you answer a question, remember those reflective skills that we learned in school. Well, what do you think? So I'm stuck here, blah, blah, blah. Okay, so where would you start? It's not about being right or wrong, but you want to be able to gauge where they're at. And we can't do that if we're jumping in and we're always answering the questions. So when we are looking at building trust and transparency, an open door policy, and in that upfront, like, I wouldn't say to ever start just, yep, I'm going to do supervision for you. Like, have a meeting. It's important to understand like what your philosophy of practice is, because we may work with the same population, but we may have completely different philosophies, and I may not be a good fit for you. Having conversations like up front, especially in the climate that we're in now, the political, the global landscape. It's not about like, I don't need to know who you voted for, because that's not my business, but understanding how are you navigating real people that are showing up, because people are political, like, so how are you navigating this? So an example could be dress up, like, and you can have all of the costumes and, for the dramatic play. And for you, it may not be an issue that a kiddo put something on that is gendered specific. But that might be something that is an issue for that family of origin. And or, you know, like depending on who you are as a person, it might be something that you're not comfortable with. And so if that kind of philosophy of practice, like if you're gonna say, oh no, you know, Bobby, you know, you can't put on the princess dress, you know, like that's for little girls, then me as Ebony, I'm probably gonna say, like, we're probably not a good fit, you know. And so having some examples of interview questions, you don't need to know where somebody went to school. I don't need to know what you did with your practicum or your internship. You know, like I want to know more information to see what your practice style looks like, to see if I'm the best fit to support you in navigating that practice. Doesn't mean that you shouldn't do play therapy. It just supervision. It just means that I may not be the person. And then reminding, you know, them that there's an open door policy. Like this is a collaborative process. You know, transparency is important. If there is something that you feel like I'm not meeting, you know, please let me know. And I agree to be able to do the same for you. With what our roles are, there may be times where we have to do role clarification for someone, and that we may have to revisit it. There will be some times where there is a scenario that might be a little gray, and the way that we process through that scenario with a supervisee may have felt more like clinical supervision or clinical consultation, even though play was connected to it. And so sometimes it's going to be like important to be able to differentiate, okay, why with this case, like I was able to do that versus why with this case, I'm not. And so we may have to revisit the role clarification and being open to that. There may be times that we have to revisit what informed consent looks like. And so that could be done with periodic check-ins. We can also do that with having some regular, like reflective feedback forms. So, you know, like there are some play therapists that have a little questionnaire that they have the guardian or the caregiver fill out, you know, before the session, so they can see kind of, okay, how have things been between sessions, you know, kind of come up with some questions that are geared back to what the informed consent says, what the roles were, what the, you know, like I don't want to know whether or not you felt like I have an expertise in neurodivergence, and that's what I say. That I don't want to know that. I'm going to go back to this informed consent that has been developed utilizing APT standards, and then in general, some best practices for our field. That's what I want your feedback on. You know, revisiting what confidentiality and limits look like. If there has to be a situation where we feel like that there is a breach, or if we feel like we may need to share something that's happened, you know, like this informed consent that we sign, like this is a document that we're always able to go back to and cite. This is where it says, what are your references? Our informed consent and our agreement that we sign is what our reference is. So any feedback that I'm giving, anything that I'm going back to, I want to be able to go back to saying, you know, in the document, in the agreement, you know, like it outlined blah, blah, blah. So this is, you know, like why, you know, I'm doing things this way. So a way that, you know, like you might be able to kind of like talk through it, you know, like just a reminder, anything you share about your client will be confidential unless there is a risk of harm or legal obligation to report. For instance, if you were to share concerns about a client in immediate danger, I would need to take action to protect them. And so being able to, the same way that we lay this out for our clients in practice, we lay it out for supervisees too. So it's very clear to everybody involved. And so in processing, like kind of through confidentiality discussions with the supervisee. In this case, we have to consider the ethical duty to protect the child in this situation. We need to talk about how we can navigate this ethically while still respecting confidentiality. And, like that's not really natural language. And, like you can tweak it, based off of what flows for you. But just reminding, like, we ultimately have a responsibility for this kiddo. My background, again, is in foster care. And so sometimes I've never met the kid. Sometimes I'm working with just the parent. But I will always tell the parent that everybody involved with this case, that your child is their client. So I may never meet your child, but your child is my client. So that's kind of the perspective that I also take with supervisees. It's like, okay, like, I have a responsibility to make sure that if there's something that is not safe, if there is a concern, if there's a blind spot, if there's a gap that I'm seeing in how you're navigating your clinical practice, it is my responsibility to lay that out there. And if I feel like that there are concerns with your practice in general, I'm not just going to leave that a conversation here. I may take that to your clinical supervisor. I may take that to your direct manager, because it is important that if I'm noticing this and just maybe a 1 hour a month that I'm meeting with you and I'm identifying a pattern, that someone who has a touch point with you more frequently, like needs to be aware of this and monitoring this. And if somebody is practicing independently, we're supposed to have those conversations with people before, like we go to the board. Like if you felt like you did need to go to the board, like of course you would do that if you felt that the situation warranted that. But I think that it's also, important to be able to identify, like working with somebody who is their own boss, and there may not be any hierarchy there besides the board, whether or not, like you sit and say like, hey, like this really isn't, like a good fit for me. Like, I don't want to police anybody, but I also want to make sure that I am practicing ethically based off of what my expectations are for APT. And I can't do that without having a way to ensure that a concern that I have is being followed up on. And so, like I'm going to sign off on, like where we're at now, but like I'm not going to be able to continue, to be your supervisor. So, and kind of just being okay with that, and what that may look like for you. There may be times where we may need to adjust the in the paperwork, same thing, kind of like a treatment plan, like you may recognize, oh, like this is actually something that I want to do an addendum on. Like if I'm going to kind of continue to work with you, like as your supervisor, these are some things that are important for me. And if I'm recognizing like that, you are kind of experiencing some challenges around boundaries or bias, I'm going to ask that those are the trainings that you prioritize. Is that, is that something that you're able to do? Like you have to take a certain amount of trainings anyway. Here are some that I would recommend. Are we able to agree that the expectation would be that by this time you've completed X amount of hours? And if it's a yay, let's update this paperwork and let's have that. Because again, this is also a way for you to protect yourself. And so you want to be able to say, if somebody comes and there's like a complaint or something does happen and somehow like your name is involved, like this person I was, like they were doing my play therapy supervision, you want to be able to have like, yes, I identified X, Y, and Z. These are the steps that I took to make sure that this was addressed. Here, we signed this. So having things in place. Because people work does open you up to additional liability, and we don't want to ignore that. Like, we have all worked very hard to be where we are, and we want to protect that. Even though we're doing a service and helping, we want to make sure we are not opening ourselves up to more liability than necessary. And just two-way communication, like this is a relationship, it's a collaboration. I may be the expert on X, Y, and Z, but you are the expert on yourself. And like we are working collaboratively to, like figure out like the best way for you to navigate the practice of play therapy. And so it's two of us. It's a give and a take. So making sure that you are putting some responsibility and some work on that supervisee, and always just like learning and professional development is lifelong, like evaluating should be a lifelong practice. And so the process of us doing the reflection and spending so much time evaluating is creating muscle memory. Like this is creating hopefully a practice that a play therapist is starting to incorporate in their routine, like reflection for themselves, that, okay, let me sit and think about, like how I have been showing up, life changes. We're people and life shows up for us as well. Now I have a child who is chronically ill. Is this the best population for me to work with? Kiddos that are chronically ill. I may be a single parent, and now my kiddo is not at an age where they're able to be self-sufficient enough. Most people want those evenings and weekend appointments for kids. And so maybe, the way that my life is set up, that the itty bitties, may not be the population that I'm able to work with at this particular season. How do we start, like kind of teaching and training our supervisees how to use that process of reflection and evaluation to be able to consistently like check in with themselves about where they're at in a particular season in their career. Okay, so ethical and legal considerations in play therapy. Everything is based off of APT, the Association of Play Therapy. So they have established what the ethical guidelines for practice are, and the emphasis is on confidentiality, professional conduct, and client welfare. So some important things to call out on that application. It says that you have to be eligible to provide supervision in your state. One thing it does not say is how many people you can provide play therapy supervision for at a time. Now, you also can like reach out and ask them in real time for clarification if they have a number, what they would say, but it pretty much kind of defaults back to your state. And so if you're in a state that says you are only able to supervise 3 people at a time, and if you want more supervisees, you have to petition the board for more supervisees, then consider how do you implement that into your play therapy supervision. Like the board of Missouri is not going to tell me, the social work board of Missouri is not going to tell me how many people I can supervise for play therapy. But I know now that we get 6. We used to have unlimited, but now we have 6. And if you want more than that, you have to request an exception from the board, and then you have to be able to outline how you're going to meet, the requirements of a supervisor and clinical supervision with expanding past that set number. And so if you are going to expand for more than that set number that your state provides, because I think most states, if they have a set, you can like request an exception. I think like kind of a lot of states, you can do that to get more supervisees. So what does that process look like? What are the questions that your board is asking you? What do they want to outline? And for us, it's basically like, how do you make sure that you get all these hours in? What does this process look like? Do you use a combination of individual and group? Like I said, I require, one group a month. It's 2 hours. And this is what, this is what that looks like. And so how are you able to provide play therapy consultation to 15 people? What does that look like? If you are providing supervision to that many people, you probably should kind of have more of a formalized process, because this is stating kind of that you are this isn't something that you're doing casually. It's something like that is obviously part of like your business. And so what does that look like? It's not something as formal as creating a certification program or being a CE provider, but okay, like these are the skills that I make sure that we reinforce. Here are activities that, like I have together to do that you have actually taken the time to build out what your process looks like. And it's important that the supervisor stays updated on any regulatory standards that have changed. So right now, the big thing with APT is that live webinars are non-contact live, webinars. And so making sure that you are aware of that, even if you're not the person, like in your paperwork, if you outline like, hey, I'm not going to go through with you and help you complete the application with where your trainings go and this and that, because, like, I don't want to take that responsibility on of if you fill out something wrong, you pay for it. And like, I don't want to do all of that. But what I do need to be able to do is make sure that I have clearly identified like how phases work. This is the minimum that you have to have of direct hours of training and supervision, like being able to, like say with you, okay, like, the best practice is that you are doing all of these at the same time. And so you can't just complete 35 hours and be done with your consultations and you're only at 70 hours of trainings. Like you can't, because you can't put all of these in a phase 1 or a phase 2. So at least being able to provide like a basic, like understanding and overview of what that process looks like, and then encouraging your supervisee to ask APT if they are stuck and need any additional clarification. And so dilemmas that can come up in play therapy. So it is kind of important to, like kind of carve out time, where we do kind of explore some of this. So dual relationships again. So if you are supervising out of state or out of even within the same state, but outside of your city. So I'm in St. Louis, and St. Louis is a metropolitan city, but Missouri is rural. And so there are places in Missouri where there's one elementary school, one middle school, like one high school. And so if you work in a school setting, your clients possibly are people that you go to church with. If you work in a school setting, you may be on the PTA, PTO, and working collaboratively with the parents of a kiddo that you're working with. So how do you navigate that, in real time? If you work for a agency where there isn't the luxury of being able to have multiple providers doing multiple services, how do you advocate for yourself? So an example, like sometimes there are situations where it may make sense for the kid's individual therapist to also do some family therapy, because like that can also be a part of play therapy, like the filial play. But being able to identify if we're starting to do more intensive family therapy, and if it is ethical for me to be in both roles. So let's say like you're working with a high conflict divorce, there's custody, the foster care system. It would not be appropriate for you to be that individual therapist and be the family therapist when those goals are in conflict. It also may not be appropriate for you to be working with that parent individually and that kid individually when those goals are in conflict. And kind of like a rule of thumb, like if you've done like TFCBT, a part of like TFCBT is you assessing like whether or not the caregiver is appropriate to bring into treatment. And when I took the training, we used like the stoplight. So like a red would be a no, absolutely not. And usually those are the individuals that are the perpetrators of the abuse. And usually like the abuse that is not like a spanking that got out of hand, but like and being careful because there's no like, oh, the nicer abuse, but because that doesn't exist. But the situations of abuse where it's more challenging to repair, the disruption in the attachment and the trust and the safety. The yellow, are the caregivers, where there may be some psychoeducation that's needed. But we kind of have to be cautious on how we involve you. Like it might be somebody who gets very activated, they get very emotional, and we don't want the session to end up being a session where this child is now being placed in an adult role and caring for you and navigating you and making sure that you're okay. We also don't want to reinforce to a child that you expressing and showing what you feel and what you think, you have to be guarded and cautious of doing that because how it makes an adult feel. And then green are the people where it's like, great, like we got it, we can work collaboratively. You're receptive to like the interventions, the recommendation, you're showing up, you're asking the questions. So these are things like that you want to be mindful of. I'm working with someone now who is at an agency where they do high conflict divorce. And so they have her assigned to the mom now. And then the daughter, they want to have her assigned to working with that daughter. And we kind of talk through, because she's not comfortable with doing that. This is a 15-year-old. And so she was going to present it in a way that was like, I don't feel like I have enough experience to be neutral with that. And I reframed and shifted it for her, like, let's take it back to the client, because we're always going back to what is best practices for the client. So with this presenting situation, and you have this 15-year-old who won't even do visits with mom, does this make sense for you to be seeing both of them? How is that going to create safe space for this kiddo? And how is that going to facilitate them kind of being open and processing when they know that you're also working with their mom? So that is what I would go back to your supervisor with, that with this situation, I don't think that this is best practice, and why. We also want to normalize exploring bias, and because we all have bias, we want to kind of start to challenge our peers, colleagues, supervisees with looking at bias exploration, not as like whether or not you're a good person or you're a bad person, but just recognizing like who you are and what you bring to the space. We were trained, with theories and interventions that left out voices for the majority of the population. Most of the fathers of behavioral health were white privileged males, and so the way that they were able to navigate the world is not the way that so many of our clients navigate, regardless of the gender, the race, the socioeconomic class, like the level of education. So taking into consideration that some of the stuff we're taught, it may not always make sense, but we all have, right? Like this whole thing, you're a blank slate. We're not a blank slate. I didn't leave outside of this door that I'm a widow. I don't leave that in anywhere. That's always part of my identity, and it may show up sometimes in ways that I didn't expect it, because I may resonate very heavily, with an experience of being a single mom, and so recognizing that, and we all have it. Our brains are designed in a way to put things into categories. Our brain makes quick decisions because this is also how we stay safe. This is also how we know where to go to next. And so, for instance, like your brain, when it sees a person and it sees the physical body of a person, your brain is going to put them in a binary category. But we know, like in doing this work, right? Like that is something that we're supposed to kind of be breaking away from. And I'm 43. I'm an old millennial. I let like my students know, like, like non-binary isn't new. There are cultures that, have talked about two-spirited people for centuries. Like this isn't something new, but the language that we have now in a field is newer. And so I'm going to probably default to names and not pronouns, because I'm not sometimes always going to be able to stop my brain from being like girl sane. Even though like it's an automatic response. So that's a bias. It doesn't make me a bad person, but being able to sit and, like acknowledge that, me asking that kiddo if you were from North Korea or South Korea, that falls into under that, and so now like that learning experience that humbled me, because teenagers will humble you, like now whenever I see something, oh, this client is from Yemen, let me look up Yemen and let me kind of get some basic information, that I don't stumble into something crazy, and my bias, and that bias is I'm a US citizen and the world are global citizens. The US is US citizens that happen to be a part of the globe. So like the way that we have to navigate the world is almost like everything, like is, like how we function, in the US, like that's normal and that's, ideal. And so like we all have bias and we all have opportunities for growth and exploration. When I went into this field, I really was just like, I ain't working with white people. Not because I got a problem with white people, but like, I got too many skill sets to be working with white people. White people can work with anybody because anybody gonna see you, but getting into it, it was like, yo, girl, that's not right, because I have grown up with a pretty privileged background, and that has impacted the access that I have and the way that I can navigate, and poverty, abuse, neglect, certain those ACEs, right? Like all of those categories we assess for, those humble the human experience, right? And so trauma is no respecter of culture, race, gender, class. And so, I was absolutely wrong. There's a reason why sometimes I have someone white that seeks me out. My name is Ebony. It literally means black. So, like when somebody reaches out to me, they know what they're looking for. And so it might be that somebody is looking for someone who navigates the world in a different way because of those multiple identities that can conceptualize what I'm experiencing in a different way. And so that was a bias that I had to undo. And so being able to normalize as a profession that doing anti-bias work is not undoing you being a bad person, as you recognizing how the way that we're socialized, our family of origin, our experiences show up. And if we're not acknowledging that, then we could possibly be doing harm that we didn't even realize, could be done. Okay, sorry. So managing the ethical dilemmas. So this is like where a lot of that reflective listening, like utilizing motivational interviewing when you're talking through with your supervisee, like bringing them back to, okay, so what does APT say about this? What are best practices surrounding this? What is the ethical dilemma? Because sometimes it's not an ethical dilemma that we're really looking at. Sometimes it's more so a personal, like conflict that, like we're looking at. Seeking consultation. So we're seeking it here, but also like this is something that I encourage you to also bring up with your supervisor, your manager. We can ask the board for questions. That's why they're there. You can reach out to APT if you're stuck. And also like reinforcing that I have been licensed since 2008 independently. I just couldn't get my RPTS. I've been supervising people for over 10 years, but I just couldn't get my RPTS. There's a reason why there's a process in place before you can go to the next level. And so if this process was in place and someone who is seasoned still has to do these steps, this should be reinforcing that being able to seek consultations from, like colleagues and peers as you're navigating your professional journey is just routine. It's something that we should be doing. So, you are supervising a new play therapist, Sam, who is seeing a child client who presents with severe trauma. After several sessions, Sam feels that they are not prepared to handle the depth of the trauma the child is experiencing. Despite this, Sam continues with the therapy, fearing that admitting their lack of experience could make them seem incompetent. One of the child's behavior, later revealed, escalates in a harmful way during a session. So, how do you feel like that you would have intervened with Sam in a play therapy supervision session when they're processing this client?
I think, just going back to what you were saying, being able to help Sam understand that admitting that he's not prepared or ready to, approach this client doesn't mean that he's inept counselor or therapist, and that he could go two different ways with that and say, okay, I don't know these things, so maybe I need to get some extra education and support and supervision in this session, or I need to refer this client to someone else. But letting Sam know that that's not a reflection of his abilities or skills.
Yeah, yep, perfect. And sometimes it is that we don't have the skill set yet, And sometimes it's that we are trying to eat an apple in one bite. And so it's not that we don't have the skill sets to work with the client, is that we're already trying to go to Z and we're not pacing and going through the steps. So like being able to help, like your supervisee conceptualize. So, maybe it is that we are trying to get to the processing of the trauma, and we are maybe being a little bit too directive, and that is causing some of the bigger behaviors that the client is having in a session, because we're not pacing and we're not on the journey with the client. We're trying to take the client where they need to go. And it's important to kind of remind our supervisees that we can see, okay, Megan has, like, we can see from an intake session, you know what, like this is attachment, these are like some of the interventions that are going to work, but we just can't go in and start there. We have to build up, and we have to allow that client to show up and be a part of that journey and take that client's pacing, like to get to that end goal. Yes, Megan.
I was just gonna add, because I was thinking about this. I have been a counselor. I graduated 2012, and I've been working in the field of counseling since then. But I just recently decided, you know what, I want to do private practice. So I'm working on getting my license. So I am being supervised now after having, years and years of experience. So it's been very interesting. But one of the things that I was thinking about in this scenario that my supervisor might even, have mentioned, was that also taking into consideration the legal ramifications. If something happens, then I'm going to be liable, and so it helping Sam understand that, it's better to say when you can't, work with a particular person or scenario, so that you can, like you said previously, protect your interest, protect your career.
Yeah, and it's not possible for us to be an expert on everything. I joke and say that we see all these therapists and I feel like they're like Pokemon, where like I got to collect them all, and you like have all these certifications, and I don't understand, I don't understand who you are as a therapist. I don't understand what you work with. It doesn't make sense. And so kind of normalizing what the medical model looks like, right? And so like your PCP, your family practitioner, the generalist, they can pretty much kind of address like most things, but when it gets to a place where you need a specialist, they refer out. And you continue to process like your asthma, your diabetes, like it's too acute for me to manage as a general practitioner. I'm going to send you to a specialist. And so being able to normalize that, like things that people are familiar with and they understand, is the medical model. And so using those examples. And so like with your supervisee, so like Sam, yes, like like you do understand, and you have worked with the spectrum disorder. But like you have primarily worked with individuals that are higher functioning, and where like it's more so helping them to be able to navigate, well, before we respond, let's stop, let's pause, let's think, and like, how raw is our truth getting ready to be? And like kind of like, and so that's a little different than maybe someone who doesn't have, like the same capacity to be verbal. And you haven't done, like you don't have as much experience there. And so, it might be important, not even just for the liability, but the client's best interest. Like, is the client getting the support and the resources that they need? You know, if we're always going back to being client-centered, and best practices is always kind of thinking about that do no harm to the client. Doing no harm to the client is not just about having sex with your clients. Doing no harm to the client is also, I'm over my head. You know, like, what your primary presenting issue is, like what your goal is, like, I'm over my head here, and me continuing to work with you could potentially be doing harm, especially when we think about kiddos, where how many kids are being diagnosed and medicated for experiences that they've had that they have not been able to process through, versus actually something organically that needs to be medicated. And so thinking about that, like, so if this behavior, because everything is like time limited, right? Like, this has been happening for so long. This is happening in so many settings. If a kiddo is not getting the right support and treatment, then there can be negative consequences for them. So kind of helping someone conceptualize through that. So we want to make sure that when we are also talking about like what confidentiality looks like, that we are reinforcing, you know, kind of like what you shared, Megan, what the ethical and like the legal responsibilities are. If we have to break confidentiality, you know, like what that looks like. I'm not getting ready to go and see if I can find, okay, Ebony said that she was in St. Louis, Missouri. She shared this about a client. Let me see if I'm able to kind of narrow it down or something. Like, we're not gonna reach out to clients and, you know, communicate to them. We're not gonna share with the caregiver, this came up in a session. What we're gonna make sure is that, you know, like, you are following the standards, you know, and if you're not, you know, then I may need to notify your board. I may need to notify your clinical supervisor. I may need to notify your manager, because you continue to disclose information to a parent that should be confidential. And setting up like what that looks like. Yes, you understand that the parent, because there are a lot of child therapists that look at the parent as like what the revenue source is, right? Like, if the parent's not happy, the kiddo's not coming back. And catering and leading more into like the caregiver versus advocating where the client is and helping the caregiver understand through psychoeducation why we're doing something this way. And you disclosing, you know, and what that looks like, you know, when I start my sessions off with any kids, you know, I start everything off with the kid and the caregiver together. You know, I go over like, why do you think you're here? Why do you want them to be here? What do you think needs to be done here? What do you think needs to be done here? Depending on like their age range, I'll use different examples. So like if this is a teenager, you know, I will say, so here's an example, you know, it's homecoming season. If Colleen goes to homecoming and she tells me that after homecoming, you know, like they did a sleepover and, you know, like they invited some kids, you know, and they, you know, were drinking wine and smoking, you know, a joint. I may not, you know, disclose that to you. And here's why. You know, I am going to want to explore why Colleen did this. You know, like I'm going to want to process through with Colleen and help to figure out, like, you know, if we need to work on like confidence and, you know, being able to not give into peer pressure, you know, if this is something that, you know, oh, okay, like, are we looking into self-medicating, you know, like, are we numbing? I need more about need to understand more about it before I bring you in. Now, if, Colleen shared that they're going to college parties and they're, with college boys, and these boys think that they're, freshmen at the local community college, Colleen, we're going to need to bring your mom, your aunt, like into this conversation. Here's why. And I want you to help me kind of identify like how we want to communicate it, and what that looks like. And if, like you're working with a supervisee that's just like repeatedly, like, you feel like there's just these violations of this kid's autonomy and their confidentiality, and these therapy sessions are not being used like for what the child is presenting with, like I am going to need to talk to somebody about what's happening in our play therapy consultations, because this needs to be corrected. And so, like discussing also, we wanted to discuss like strategies for and best practice for documentation, and then what the limitations may look like for legal mandates. So again, like I said, like, we could be supervising people across state lines. So we may not know and be experts on all of the rules. Sometimes we can be in our own state and may not know. I also work for managed care, and each state has a different guideline for what is protected information for behavioral health. It looks different for the level of care. So if it's inpatient, residential versus if it's outpatient. It can also look different for substance abuse versus mental health. So it may not be the same age across the board in one state for it may not be across the same for every level of care. So it could be for some states as young as 12, that once a kiddo is 12 years old, their mental health information for outpatient therapy is confidential. And when a parent is calling to get PHI, protective health information, I'm even talking about a claim. A claim is protected health information because a claim indicates that services happened. And so before the insurance company can tell the subscriber, why this claim was denied and what needs to happen to fix it, we have to send you a release of information to have your 12-year-old complete to put on file before we can communicate with you. So those are nuances that lots of people don't recognize that exist in their state, right? And so making sure that you are encouraging your supervisee to understand that, because when you break that, now there's liability there. That same parent that pushed and pushed and pushed for information can now say, oh, my kid didn't have a release of information on file. I want to file a complaint for malpractice. I want to report you to your board because blah, blah, blah. We're dealing with high conflict, divorces. If we're dealing with, just custody things, like you just have to be mindful, like you thinking that you're being helpful can sometimes backfire. So I always tell people that if you have notes that are your private notes, no one should know that you have private notes. And that's all we say about private notes. Because I don't even want to know how you store and how you're keeping private notes, because now I know you have private notes. I don't want to do that. Just your private notes. If you have private notes, no one should know about private notes. Even if you're using those EHR systems, like you have to recognize and understand that the attorneys that work with medical cases, like they're aware and understand what EHR systems are. You know, like they know that, you know, like if you use Simple Practice, you have whatever that note is. And then like you have that little psychotherapy note that's your hidden note. They're aware that those things exist. So you want to be mindful of how you're documenting and where you're documenting. Your documentation also just needs to meet best practices for insurance companies. And what that's going to look like is whatever the diagnosis is, the date, the time of the session, whatever CPT code that is that you're using. You know, like you can kind of use that SOAP format, but just briefly, like what happened in that session, what interventions you used, and you know what treatment goals you're working on. You know, if you are spending more than 15 minutes doing a note, I can guarantee you that you have too much information in your note. Your note just needs to be able to justify to, and we're all not using insurance, but I'm just using that as an example. But your note just needs to be able to pass an insurance audit where they can say, okay, Colleen came, Colleen was talking about, you know, missing the dog that died. You know, the intervention, you know, was an art project that, you know, helped, you know, like the kid process through their grief. This is connected to this goal. Your documentation just needs to also have enough information where you can follow it and you can, you know, like know what happened. Okay, like this makes sense to me. And if you do work in an agency, it just needs to be clear enough, like in case you ever leave, that someone now who is working with this client can kind of have an idea of what you all were working with and where the client's progress is, because they don't need to necessarily pick up right where you left off, because now they're going to also need to go through the process of getting to know that client from themselves, building rapport, engaging the client collaboratively on what you need to work on. So it's just very important that we are not writing dissertations. You know, we are not writing novels. You want to keep it as brief as possible. Even when you don't think that you work in a space that has a higher likelihood than another of being subpoenaed. Like I work with a lot of foster care youth. So obviously I know that I'm working in a legal system. So there's a high probability that someone's going to want my records and or me to come to court. If you're working with divorce, there's a, you know, like possibility, right, for that. But if you are just a private practice and kiddos are just coming to you for routine, run-of-the-mill issues, you may not ever think that someone will request your medical records, but they might. You know, there's a reason why we're supposed to keep them for like up to 7 years. You may have a kiddo that, oh, we're thinking that there was ADHD here. Their doctor now wants some medical records, you know, like just for that background. But in those notes that you shared, if a guardian reads something, and if it's the way you worded something, you know, if it's that something is in here that I had no idea about, like always just remembering that your records may come back up. Yes, Megan.
I was just thinking, because I used to work, one of my jobs, I was working with a family drug court. And so I worked primarily with the parents, but I had to keep a lot of records that I would have to go to court and, you know, make recommendations or, you know, kind of report on what I had documented. And of course, that helped me learning what, you know, was most important to document. But I don't know if it's just coming from, I'm in Alabama and I've worked with, you know, in Alabama. And so many of the professionals that I've come in contact with have, and maybe it's because I was with agencies, but they would hire attorneys to get us out of going to court. And, it was just very much like that's, not a part of our job. We're not supposed to go, and report our work to the courts. However, I did find that in my position with the family drug court, that a lot of what I had to bring to the court was beneficial to the client and that I was able to advocate for them. And so I'm just curious your perspective as a supervisor. How are you going to encourage your supervisees in best practices for when is it appropriate to go to court? Should we try to avoid it at all costs, or are there times where it is going to be helpful for the client for us to, advocate for them in court?
Thank you for that question. That's actually great. So going back to like first starting off with that foundation is, what is your philosophy of practice? So I let people know, like, in the classroom with students, this is not a field where you get paid for everything that you do. You cannot clock in. Well, I mean, depending, like on the setting. So let me take that back. But like you doing documentation, you doing a treatment plan, the billable hour is the billable hour. You can't charge somebody for how long it took you to listen to let them, and come up with reflective questions to share with clients. Like you can't bill somebody for that. So first and foremost, taking into consideration what that looks like for you. And then you need to kind of identify like populations that make the most sense for you to work with based off of what your philosophy looks like for getting paid for all the work that I'm doing. Then you need to take into consideration certain populations that you work with, what our ethics say, and it says do no harm. And so personally, I understand most of the time people don't want to do it because it's time consuming. You're not getting compensated, and or just being intimidated. But I prefer going to court. And this is why I prefer going to court. I can control what comes out of my mouth and how it comes out of my mouth, but I cannot control the way that you interpreted my notes. Regardless of how effective I was at documenting and doing best practices, it's like Hamlet. How many people think Hamlet was really crazy versus how many people think Hamlet was playing a game? And you can read Hamlet plenty of times and you can find references that support either theory, right? And so it's the same thing with, like our documentation. Like people can interpret it and utilize it to support them, and that is what each side of the legal counsel is going to do. Like they're going to go through and try to look at your documentation and figure out how it supports the end goals for their client. So for me personally, I think showing up is better. But if that is something that you are not comfortable with doing for whatever reasons, that's also fine. Doesn't make you a bad person or a bad clinician. Some things that I would ask about is, can you like let me know like maybe what you're looking for? Like sometimes like I don't like, and I educate clients like, okay, like you're wanting this letter for accommodation, like you're wanting your records to send to the school to get some accommodations, but sometimes having those records can also do harm, because now somebody can see something that you didn't recognize or realize would be there, and it can open another can of worms. So instead, what I would like to do is to be able to write a letter. I would like to be able to identify how long I've been working with you, the frequency of our sessions, what our treatment goals are, like how your symptoms manifest, and what would be, like supportive for you. So it could be something like, that, like because of the trauma history, like, like we can have a fluctuation of like, trauma symptoms that are hypervigilance, like some flashbacks, some triggers, things that like schools are loud, and that can be triggering. the noise. Recess can be a trigger. Lunch can be a trigger for kids, right? And we don't think about that because these are fun things, right? So even being able to put like, so if this kiddo is able to eat lunch, in, like a counselor's office, if there's somewhere else that they're able to go and eat lunch, if there's an alternative that they can have to going to recess, and here's why. Our goal isn't for this to be long term, because we do want them to be able to integrate, but in order to reduce blah blah blah, here's how we would like to do that. So I try to the best of my ability try to avoid doing records, because I like to try to control the message, because I feel like for me, the way that I interpret do no harm with my social work code of ethics, that's how it falls in alignment for me. I also, I don't do the AI with the EHR systems. I'm not gonna say whether or not you should or you shouldn't do it, but if you're trying to figure out a way to be more efficient with your documentation and effective, you can also use something like ChatGPT, where like you just throw in, like you're talking, this is what happens, like make this polish and make this a note. And then, most EHR systems, they populate that note, the previous note, into the next session note. And so like you can kind of, okay, a lot of times it's kind of a similar thing, but it's something different that we're tweaking. But if you are like doing like audio recordings, is really important to make sure that you know the best way to secure that. If you are using any AI, doing your research and figuring out the best way to have that AI system on, like whether it is you're using a tablet, an iPad versus your phone, because from my understanding that you can just kind of start it in a session, like, and it doesn't have to be telehealth. You can do it in an in-person session, and AI just kind of goes and transcribes the session for you. Again, EHR systems, they do kind of keep everything in a cloud. It's, like in this platform, but making sure like that you understand how to export data and, like the information from that EHR system before you identify one that you want to use. Some of them are easier to export from than others, because again, you have to keep your records for a certain amount of time. And you're not going to keep paying Simple Practice if you shut your practice down, just so you can have access to the documentation. So making sure that you understand that. And then also, if you are working in an agency or for someone else, making sure that you're very clear on whose responsibility it is to maintain those records. So whose clients that they are. So the clients typically belong to the agency and or that practice. I had a subpoena this last week that we had to send. Neither one of the clinicians that worked with this person are even still with the agency. One of the people I would have no idea how to get a hold of if I needed to. But I did have the documentation. And so that was a situation where I had to send it. They sent it to the community reach. They didn't try to find those two clinicians. They sent it to the agency because that's where the referral was made. So making sure that you understand those nuances and the setting that you're supervisee works in, so you can kind of help guide them on like the best practices. So during the supervision session, your supervisee Maria shares concerns about a child client's behavior. Maria mentions that the child has been drawing disturbing images in therapy, but the child's parents are unaware of the situation. But Maria is worried that these images could be an indicator of potential harm, but hasn't yet discussed the issue with the parents. Maria asks you for advice on whether to break confidentiality, to speak to the parents, or whether to wait until a clearer picture emerges. So this is just pretty simple. Are we waiting or are we disclosing? All right. Well, I would say that we would wait. And the reason why we will want to wait is because we don't have enough information right now to disclose anything. We don't know what's happening. And the worst thing that you want to do is to share a hypothetical something to a caregiver. You don't want to create additional worry and anxiety and hypervigilance and policing, of a kid where they're now like investigating and trying to figure out what's, happening and you don't know. The disturbing drawings that Maria is drawing could just be that Maria was being babysat by an older sibling, and that sibling thought that Maria was asleep, and they watched The Conjuring. And so, like Maria is having, or the client, or sorry, is having, like some challenging times because they saw some things that were disturbing, like for a 6-year-old, to see. I tell people all the time that my son is going to get me hotlined because my kid says stuff all the time that sounds very suspicious. We use the anatomically correct terms because things that I say, like with another thing with psychoeducation, if I said right now that he keeps getting in my pocketbook, what would everybody on this call think I'm talking about? Probably literally a purse, right? That somebody keeps going into my pocketbook. But this kiddo could also be talking about that they're being like sexually abused, because people don't use anatomically correct terminology for kids. So this is important for you to, this is a great question when you're doing the intakes. How do you refer to certain things? And then even starting to say, okay, so just that question that I posed to you all, pose that to a guardian. And then showing them how easily someone may miss that your kiddo is trying to communicate something to them, because the world doesn't know that pocketbook means vagina. Granny, the world didn't know that when you was talking about possum to us, that you were talking about a vagina. But if you would have used that word, then people would know exactly what we're talking, like what we're talking about. And so why you may think it's a big word, but these are the words where people know exactly what you're talking about. Like everybody doesn't know that. When you say somebody is messing with me, everybody may not know that your child is talking about somebody sexually abusing them. And so why it's important for us to use, like certain language. So the contracts, they are gonna, hold everybody accountable to ethical and professional standards. It sets clear boundaries and expectation. And then it also does, provide you with some legal protection. It may not be that something happens where it's a client liability issue. It may be that, like somebody is saying that I did not get X, Y, and Z, and I want my money back, like from you. People do the most bizarre things. So like having that contract is important. Elements that you want to make sure that you include in that contract are what the expectations are, the frequency and the duration of supervision, what the ethical guidelines and confidentiality looks like, how we handle dilemmas and dispute, and a fee structure if that applies. And with the frequency and the duration, it's important that you lay that out like the way that we lay it out with, like a client. If you are 10 minutes late, we'll have to reschedule, or, because like we have to do this hour. If, like you have a maximum of how many consultation hours somebody can have in a month, because again, it's 35 total, and it's very clear in those phases how many you can have in each phase. And so, like kind of outlining, like what that looks like. If you are going to help them with that, their tracker, and I'm going to send that, Colleen, and you can share it, kind of like an example of a tracker that you can share with them, where it's it kind of outlines the phases. It's a place for them to put, how many training hours that they have. And so like, even if, like occasionally looking and you like kind of checking that, you're giving them the autonomy to be able to say, I want to count this as special topics versus a theory, because you can do that. But also putting in there like something that clearly outlines in your contract that I am not responsible for whether or not if APT approves your application. Being very clear with that. And so we want to normalize that, like ethical dilemmas are a normal part of the work that we do. We work with people and people are complicated. There's like we're not experts. And again, like I said earlier, we're not blank slates. So what we bring to this space, like it shows up. Someone else can have the same PowerPoint, right? And they can present this material and they may bring up completely different examples, right? Different scenarios, like different things to consider. And so, like keeping in mind that sometimes like having that ethical dilemma can also be healthy growth. Because that can be like not looking at it necessarily as a challenge and a problem, reframing it and looking at it as an opportunity to be able to grow and explore. Recognizing that I may have a limit to what I'm able to do, but I may be like what I'm able to understand, like because of my lived identity, my lived experiences and my identity, but I may be the only option that a client has. And so just the numbers, like just aren't there. Like mental health is a white field, and unfortunately, like every single person of color could only see people from their identity group, but their ethnic group, but was still not enough of us to fill that gap and that void. So that means that we are going to need you as our counterparts, our colleagues in this space, to be able to provide like safe, and competent, care. It doesn't mean that you have to understand what it means to be a Black male in a predominantly white school environment. What it does mean is that you have to be able to hold space and recognize that being a Black male in a predominantly white school environment could be impacting and showing up and internalized in different ways. The way that kiddo may be navigating, experiencing school could look different. Being woke, and there's all these things like now that we're the climate that we're in and what DEI looks like, but being a human being is just being a human being at some of these things. And so recognizing that there is a discrepancy on how behaviors are viewed in the school setting when the kiddo is white and when the kiddo is non-white. And that unfortunately, the lens that a lot of systems look like is behavioral when it comes with children of color versus something emotional or something external that they're responding to. And so I live in St. Louis, and there is an area in the city. There are some areas where there used to be signs that said, "We must stop killing each other." And they would be in predominantly Black where there's, like some violence, drug activity, like gang violence. There would be kiddos that are living next door to abandoned buildings, kiddos that are coming outside on their way to school, and there's like blood stains on the sidewalk from, so just thinking about like this kid, like how dysregulated a child that lives in that environment is, right? Thinking about your home is supposed to be your sanctuary. Your home is supposed to be a safe space. If you live in an environment where you can't even go out to play, like what does that say? Or if a kid is being like abused and neglected, or there's domestic violence going into the household, and like there's a parent where there is substance abuse or severe mental illness that's not being managed well, like what that environment feels like to them, like when is their nervous system ever regulated? And then I go into a school setting, I just didn't leave all that stuff behind. My brain is still developing. I don't have, the cognitive or the emotional capacity to navigate the things that I'm experiencing, right? And so like, how do we like shift? Just how like throwing that out there and the way that I did that didn't create a space where it was like, oh, you white, you come into this and it's blah, 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 right? Like, so how we can communicate things where we don't alienate, and we kind of open up an opportunity for people to say, oh, I didn't consider that. And so when I say like ethical dilemmas, sometimes those can be opportunities of growth and ways to explore. Our decision-making framework. So you want to kind of have some type of a model, like to be able to like kind of help someone kind of go through like kind of that hierarchy, of, okay, is it, you can kind of look at the hierarchy of needs, right? Like, and like, so first, is there any safety issues, like any risk of harm, okay, any areas like where is there any neglect here? Okay, do like I see any areas where maybe there's an opportunity for like the caregiver to have more capacity to hold space for the social emotional development and understand that differently. So like looking through like, okay, how do I intervene here based off of what's showing up? And if we don't have any safety risk or concerns, or like neglect there, okay, so now how can we go through, after we've done that triaging, now how do we go through intervening, and what do our next steps look like? We want to continue like kind of showing up in as yourself, being an overshare, like with that self-reflection, like modeling that. We want to provide supervisees with strategies that maybe we've used that have been effective, have not been effective. Want to talking through like example, like our what we're taught is that you don't self-disclose. But thinking about like if you're working in communities where relationships are very important, that can even be a rural community. It doesn't even have to be like you're looking at culture or ethnicity, but just think about if you are working with a population and connection is really important. It's and you have a client and this client has just asked, do you have kids? Like, are you married? And your response is, it sounds like you are really interested in whether or not I'm married and I have kids. I wonder why that is. Why do you think that is? Like depending on the population that you're working with, they up, like this is it, I'm tapping out, like I won't be back, because that's just a simple thing. Girl, do you got kids or not? Are you married or not? Like what's the big secret? And so like, also being able to like recognize like, how do you do that? And not to say that everybody has to be comfortable answering those questions, right? And disclosing it, but there's a way that you can respond. So an example is like we're in a climate and people are reinforcing, right, that it's important for some clients to understand like who you voted for, so that they know whether or not you're a safe space. I'm not answering that because again, for me, I go back to we don't sacrifice our personhood for the work that we do. And so for me, that is more an invasion of my privacy than somebody asking me, do I have a trauma background? And I mean, that might seem weird to somebody, but that for me, like, and so the way that I would respond to that is that I definitely understand why that is important to you. Like, we are, like living in a climate where there are a lot of things that are happening. They're happening very quickly and they're impacting people on multiple levels. I can definitely understand why it would be important to you to be able to recognize like whether or not, like I hold certain beliefs or I'm safe for you to be able to share certain things. So a couple of things like I would like you to consider, a candidate somebody votes for, it does signify like maybe some things, but it doesn't necessarily give us a full picture of a person's belief systems or who they are. Also, that is just not something that I feel like because of that is effective in helping a client navigate and understand like where I lie. Because regardless of what candidate I tell you that I voted for, I don't know that that really answers what you're wanting from me. So instead, I'm gonna try to answer it, and you let me know if this is landing. So based off of what you shared, you're wanting to know whether or not I'm competent in working with someone that holds a queer identity. So here's the work that I can let you know that I've done. I've worked in this space for X, Y, and Z. I predominantly work with clients that present with these type of issues. I am finishing up a certification in, like sex therapy, like going through. So like, this is something like, like that, like I navigate, like I navigate, have navigated before. And this is probably, about 30% of the clients I see right now hold that identity. Is that helpful for you to hear? Like, does that help answer? And so like, that's a different way of approaching that versus just like shutting it down. Because we do want to validate like the why, why certain things are coming up. Now we are getting to the point, sorry, I didn't have that title slide, but the self-assessment, like this is a lactase of, like figuring out like whether or not you are ready to provide play therapy supervision. And this is important, just because you are eligible to do something, it doesn't necessarily mean that you're ready to do it. There's a reason why you have to go through so many hours of training to be able to be a clinical supervisor. There's a reason why you have to go through so many hours of training to be a play therapy supervisor. You need to have like a foundation of understanding what the scope of that is, what your responsibilities are, and like how that connects to the discipline or the discipline that you are working within. But I also think that it's important for us to do some inventory of ourselves. So engage in self-reflection. So like really sitting and thinking about who you are as a practitioner, where your expertise lies, where your weaknesses are, what supervisees would be the best, like for you to take on. Some people don't do right, like those consultations for clients to see if it's a good fit. But I would say like with supervision, you want to make sure that it's a good fit. And sometimes like being a good fit isn't just that you're familiar with somebody. I may have had a student in my class and you may have been a brilliant student and a complete delight. and you reach out to me for supervision, and I might tell you that I'm not the best fit. Because you have a desire to work with to work in gerontology, and that is not something that I do. And I believe that supervision isn't just about satisfying a requirement, it's also developing somebody, their skill sets and their professional development. And I don't have anything that I can assist with you in this area besides just being able to sign off that you met with somebody for the required amount of hours. I feel like that's just not what supervision is supposed to be. It's supposed to be able to provide you with the support that you need to be able to go independently and practice within the scope like of with the population or the presenting issues that you're working with. Self-reflection also provides us with opportunities to recognize, like where there are opportunities of growth for us, because we're also learning and developing. It's important that you are familiar and understand like theories and techniques. Your supervisee is going to training. The expectation is there's a reason why these phases are set up in the way that they are, and they want you to do all three elements, at the same time. And so in your play therapy supervision, we need to be able to reinforce, like some of these components. You may not, do a ton of filial therapy, but you need to at least be able to have a working framework of what that looks like. And for you, it might be that with some of my continuing educations, I focus a little bit more on exploring some of these different theories more in depth, just so that, like I'm able to have something meaningful and constructive to add to supervision, to a supervisee. You need to also be open to seeking peer consultation, like you say supervision, but like peer consultation, like for yourself. Colleen is a RPTS, and Colleen will have more experience than I do when I go out. And so it may be something where I need to say, hey, can I get, like some time on your calendar? Can I schedule a time with you to kind of just process through setting up the documentation? Or can you help me like kind of, like maybe understand, I have somebody that is doing PCIT, and I'm not super familiar with it, but I know that that's something that you specialize in. Like, can you kind of give me a really quick overview and like things that, without going in depth and doing a certificate, because that's not what I want to do, but how I can kind of conceptualize, because again, we're only doing 35 hours. If we were doing clinical supervision, then maybe it's more important for you to have a more in-depth working knowledge of some theories and interventions, but we just want to make sure that we have a clear enough understanding to be functional. And then we also can get stuck. And so sometimes it might be like, hey, can I bounce this off of you? And can you help me see if, like this is my stuff showing up maybe, or if you're seeing the same thing I'm seeing. Engaging in continuing education. We want to make sure that we're making it meaningful. Like we're not just, checking a box. You may not be able to do every conference, right? You may not be able to do a conference at all, like you may not be able to do the workshops. But what are the opportunities that you have and that you can take where you are able to get really meaningful information that continues to facilitate your knowledge base as a play therapist and a play therapy supervisor? Self-assessment tools. So questionnaires that, like you may provide to, like a supervisee, like to maybe give you feedback, but also things that maybe you create something and it's a guide that you kind of say, okay, based off of APT guidelines, where do I feel like I am here? I've been working with, you know, therapists for maybe the past few years. Like what does it seem like people seek me out for? Like what have been some of the common themes? What has been the most productive use of the play therapy supervision sessions that I've conducted? Which ones have gone like the best? Like, like kind of just sitting with yourself and kind of assessing and, like doing some self reflection and evaluation. Soliciting feedback from your prior supervisees. Like this isn't like clients where, like we can't have a client testimonial, even though sometimes we do see those on some people's websites, but like we're not necessarily supposed to solicit that from a client, but you can get that from a supervisee. And it could be something that like after they're done and you've completed their paperwork, so like they know that there's that power dynamic isn't there, like, here, can you complete this for me? Like, I would appreciate, like any feedback that you can provide. Please be as honest, as you feel comfortable with, because my goal is to make sure that, I'm providing, the best supervision that I possibly can. And I'm not experiencing me, I'm not a new clinician anymore. So, like there may be things that I haven't considered, and that you can help give me some insight. Making sure that you stay up to date on the guidelines. Like APT has changed some things, right? And so making sure that you're aware of it. And so if you are working with somebody and we know like 75 of those hours have to be in person. And to me, what is ethical in setting, those price points, and even, like going into um, an agreement, like with the supervisee, is in that first like consultation session to determine if it's a good fit. Also like assess and figure out like, how are you getting to the point where you are satisfying the requirements? You live in Alaska. What is your plans for getting those contact hours? Have you gone on APT's, like website? Have you looked at to see, like who are the approved providers by state? Like what cities are you the closest to? I think we might have like 7 or maybe 8 approved providers for the state of Missouri. Most in-person trainings are going to kind of be around universities or in the more major metropolitan areas. So like, have you looked at what is your plan to figure out how you're going to do this? Because also part of my responsibility is like making sure that you understand and you're aware of what the requirements are for APT. Okay, so if there's nothing in your state, there's nothing within like a 4 to 8 hour drive, financially, you don't have a ton of, like disposable income. How are you going to make these in-person trainings? You need 75. So you kind of at least want to do, like 25 a phase. So how do you do that? Like what's your plan? Before we start this process, I think that's important, because otherwise, like, like you're wasting money. Like you're getting some support, but you're not working with me to get clinical support, you're specifically wanting to satisfy the requirements for the play therapy certification. Again, like, like reinforcing clear supervision goals and objectives, like just thinking about what your experience was like, like going through supervision, also what your experiences was like, like on the job, right? And so how many times have you been in a position and you've had a job and you're not really super clear on what your manager like necessarily wants for you, what the expectations, how you're being evaluated. So making sure like you're really clear on that. So if you have like key areas that you're looking at, which should look at the competencies and those areas that APT looks at, the theory, special topics, like the diversity, all of those categories, you want to think about how are ways that you're able to connect some type of goal and objective that you can evaluate, like your supervisee on. So like your goals and objectives, you don't want them to just be something random. You want everything to go back to what APT requires, because that just reinforces that certification process, and it becomes like muscle memory. Making sure that you are really clear on what the licensing and certification requirements look like. Somebody understanding that if they're starting with you and they're provisionally licensed, that they understand like you're not going to get the certification until you are independently licensed, because you can't be certified in something and you're not independently licensed, because we can't certify you to practice independently when you can't practice independently. And so like kind of, so what does that look like? Where are you at in the process? If you're overlapping, understanding that, yeah, it might be a minimum of 2 years, but also understanding that, if you don't pass that exam, you can't submit that application yet. And that there's so many years that you have where things start to fall off. So, what does that timeline look like for you? It's not necessarily bad to do things. Oh, I'm sorry, I'm moving this around, but I did not move these. Oh, I'm sorry. It's not bad not to do that, but kind of talking through that with them up front as much as you can do in that initial consultation, setting as much like questions like and information and things that you can share regarding the certification process and what APT's guidelines are, the better off you will be to figuring out like whether or not somebody is a good fit for you. Making sure that you are really clear on what the structure for your play therapy supervision sessions will look like and what the plan is. We don't really want to go into, like kind of something just super relaxed and flexible, and we just kind of pick things up as is, because again, these are just 35 hours. And so we want to really make the best use of this time. And again, we are putting our reputation, our certification, our license on the line. We are gatekeepers. We're vetting. And so you want to make sure that this time that we're spending, like this isn't just us like hanging out and, chit-chatting and, kind of having those kind of like jokes like, oh yeah, the frequent flyers, ha ha, no, like let's get down to business. It doesn't have to be, rigid, but it's intentional, the time that we're spending together. Reflecting on where you are with on cultural competency. Like at the end of the day, like even you can be a part of a community, and that doesn't necessarily mean that you are an expert. There's not just one way to be an identity, because people are diverse. I co-facilitate a course with someone in a bias activity that we do the first day of class. is that we kind of put our, like a brief description of what like our childhoods were like. And we ask, you know, like the students, like who they think is who. And disproportionately, everybody thinks we're the other. So mine is, you know, I know what Good Times is, but I ain't ever seen a full episode of Good Times. You know, like I just ain't, or Fat Albert, or like all of the things that are supposed to be like super stereotypical Black. I grew up watching Shirley Temple. My favorite movie is Gidget. I went to State Farms. I mixed milk cows. You know, like I played with pigs. My grandma grew up in a small rural community on a farm, like Little House on the Prairie, where all the kids were in a schoolhouse, and her family was the only Black family. But she grew up in a farming community, and farmers, like we work together, you know, and we kind of have our own little community, you know, like regardless of kind of what's happening, like sometimes in the larger world. And even the way that my grandma grew up, it was completely different than my grandpa. My grandma didn't experience certain things that my grandpa did, who grew up in town. But my co-instructor, she grew up extremely poor in a rural environment. She's the first person in her family to graduate high school. There was physical abuse. Her dad, you know, like tried to kill her mom. All of these different things, you know, like siblings with substance abuse, you know, different things. And that's just an exercise in a way to be able to like kind of reflect and check with that bias. And it doesn't mean that you're a bad person, because we are conditioned, and there are messages and there is information that we are being fed about what certain people are like. And if you have never experienced a certain culture or a certain group of people, what do you have to go by? Movies, you know, the internet, you know, like TV. And so just kind of normalizing like, oh, you know, I might need to just like, you know, like kind of do more listening, you know, again, you know, most of the time somebody doesn't expect you to understand what they have experienced or what it's like to be them. They just want you to create a space where you are listening, you know, and you are validating, you know, like that what they have experienced, you know, isn't fair, you know. And the last component is assessing for compassion fatigue. You know, we do a great job of telling people that you can't have romantic relationships with clients, and you know, you can't go to Facebook and put all this information when you're trying to look for a referral. But we do a horrible job of preparing our practitioners, you know, across disciplines, for understanding what compassion fatigue looks like. You know, an easy day for us is still stress. We are dealing with people. We are dealing with, you know, complex, you know, situations, experiences. And if we're dealing with kids, like there's really like no happy, positive way to like frame kids hurting, you know. And you know, because a kid experiencing something somewhere means that somebody responsible for caring for them or providing for them, there's a gap somewhere, even if it's not intentional, like something is happening. And like ideally, in an ideal world, that shouldn't happen. And if you're in the sessions, I mean, a setting where you're dealing with a lot of complex, you know, traumas, it can be hard, you know, like to turn that off. We don't deal, we're not in a field where after I leave the work, my parking lot at work, you know, it's over with. You know, when I get home, we work in a field where, oh my goodness, like this client just popped back up. Like, did I handle this right? You know, was there something else that I could have done? I hope they come back to the next session. I hope, you know, that, you know, they're not in trouble, like for expressing something in this, like family session. Oh, like I didn't realize that, like this was going to activate something in me in this way. And now, like maybe that I'm parenting myself, it shifts even the way that like I feel about certain things differently, because now, like I'm parenting and I just view things, like completely different. And so what does it look like to take care of yourself? So our interns, we provide our interns with 2 hours a week of self-care. And that is supposed to be something that they use as a reflective practice to identify what are things that I can pull into my toolkit to take care of myself. What are strategies that I can use to self-reflect and check in with myself to see how I'm doing? Because ultimately, no one comes into a field, spends this ton of money to 5 years in, be like, you know what, I'm done. And so like, how do we figure out how we can have longevity, in this field? How do we figure out like, okay, how we can pivot, and maybe do work in a different way until we're able to come back to this, space. And so I would say like you starting to practice that for yourself and then start to be able to model that, like for your supervisees. And we are at questions and any final reflections.
I just want to thank you for sharing today, your expertise, and it's been wonderful. One of the things that I have really gotten into lately is like interdisciplinary teams and working with people from different, educational backgrounds. And I'm a counselor, and for whatever reason in my program, like the general gist, the feel was to kind of look down on social workers, but I am all about social work and the social work perspectives and what that brings to the counseling profession. And you definitely epitomize that. I wish I was a student and could take all of your classes. And I do hope that your plan is to get a PhD at some point, because like you are fire.
Oh, thank you. I appreciate that. Thank you.
Yeah, absolutely. I mean, this has been wonderful. Cannot thank you enough for today's training. I think one of the things that'll really stick with me is I just loved earlier too when you said like just because you're eligible to do something doesn't mean that you're ready. And I think trainings like this speak so much to kind of understanding that, yeah, like certain states and even APT like have requirements of like, okay, you check the box, you can do supervision, or you can do this next level skill. And it's like, well, can you? And so I just really appreciate all of the knowledge that you brought with you today. And for those that are attending live with us today, as well as those that are watching this recording later, which I hope many do, but I just want to really highlight too that Ebony provides play therapy workshops through BMH. And like I mentioned earlier, she also has a nonprofit. That nonprofit is approved through NBCC. And can I share that we're pending other?
Yeah. I'm just waiting for
approval as well through her own nonprofit to provide additional workshops and trainings, which are going to be incredible. In your email, and you've got flyers and references about some topics that are coming up. We will continue to post about those as well. And Ebony brings with her so much experience of working in schools and hospitals, private practices, nonprofits, managed care. And as she talked about a little bit throughout this training, specializing in foster care and trauma and parenting and grief. And so workshops that also focus on those topics, but administrative aspects of therapy and differential diagnoses and documentation, like we were talking about here at the end, compassion fatigue, supervision, so many incredible things. She doesn't know yet, but I have plans to hopefully collaborate in the future as well, because this training has been phenomenal. I put the link to her website in the chat, so be sure to check that out. I also put a link to the quiz and the evaluation For the evaluation, there's a little box that says like, yes, I want to be added to the mailing list, or I'd be interested in doing trainings. Just put your email address if you check those, otherwise we can't reach out to you. Thank you again, everyone, for being with us today. I appreciate everyone being here, and don't forget that you need a training.
Thank you for joining in on today's training. We look forward to having you join us again. Heart and Solutions is proud to provide CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below.